Okay, hello my darlings, it's Michaela. So I wanted to continue this lymphatic drainage train simply because of the amount of interest that's coming into the office as well as my own use of it lately. So the other week I talked about having surgery, a basal cell carcinoma removed from my head on the 27th of May. And since then, I have been doing lymphatic drainage on my face to help speed healing. So if you have something that you want to heal on your face, that's what we're going to do today. Black eyes, bruising, acne, wrinkles, allergies, puffy eyes, if I didn't already say that, tooth pain. This could be helpful, all right? So what you want to think about doing is basically drawing a line down your face, okay? And ultimately, this splits your entire body and informs you where lymph is going to go. But for the intents and purposes, we're just thinking about here, okay? And then I want you to think about basically drawing another, like a, top of a triangle or a diamond, not just at the apex of the bridge of your nose, but just above. So kind of getting like the corners of your eyes to the edge of your jaw, to the corner of your jaw, all right? So basically, one side goes into one side, the other side goes into the same side. Half of your face, the lower half of your face goes out. I'm sorry, I lie. It goes down. And the top half above this diamond goes out. All right, so here we go. So what you want to think about doing is basically pulling on your skin and pushing fluid, which you can so easily feel underneath your clavicles. Everything drains into your clavicles, okay? Then you just want to think about working up. We're going to do this quickly. Generally, you want to spend 20 minutes, okay? That gets lymph up and going. Lymph does not have its own pump. The more you work out, the more lymph will keep moving in a pleasurable pattern, at a pleasurable speed, but it moves slowly, okay? So this kicks it up. So basically this moves junk out of your body faster, so it helps you heal quicker, period, all right? So basically, I'm pushing lymph underneath my clavicles. I'm working up. I'm hitting something behind my ears called the water wheel. There's a lot of action that happens here. And then as I move back down, this is called rinsing. And what this does is it prevents backup. So this is my point of concern, right? But if I start here, there's all this other stuff that comes before it. So I need to clear space, okay? So I work back up my neck. I'm thinking about behind my ears. It's an indentation. If you're sick at times, you've probably felt a swelling back here, pain back here, lymph nodes, fighting infection. It's called your water wheel, if I didn't already say that. Then you want to come in front of your ears and think about pushing towards your ears. Okay? And now this is where this line of delineation matters. So I'm thinking about basically tracing my jaw. Everything kind of follows your jaw back up to your ears. Okay? Some is great. Just give a little tug in the right direction. Everything will be perfect. Towards your ears, behind your ears, all the way back down, rinsing. So amazing. You can do this lying in bed in the morning or at night, in the mirror while you're washing your face. And then basically, within this diamond that is my face, I'm just thinking about pulling everything underneath that down. So obviously, lymph is not flowing between my lips, it's going around it. But I'm just thinking about down. Around the nose and closer to the eyes gets juicy. So I'm going to clear that before I go back. All right, so I was just there. We're just going to go back. But I'm thinking about working up towards the nose. I'm just thinking about down, down, down. And I can feel more pressure around my eyes when I push. There's just more stuff happening. And obviously, I have an incision, which some of is potentially draining this way. When I first had this done, I had a lump at the base of this incision. And so lymphatic drainage was something that helped me to move that quicker. So basically we just did that little diamond. So I'm just going to rinse that, and we're going to do the other half of the face, okay? But the intention is to always be moving the fluid closest to the clavicles first. There's a lot of stuff going on there. Temples, again, super hot spot. And then working up or out or away. Okay? And then I'm just going to finish this. So remember, straight down the center of your head. This skin, my plastic surgeon told me to treat it exactly like the rest of the skin on my face, but it is not like the rest of the skin on my face. It is a wound. There are scabs, and the skin has been traumatized. And it's healing, that's for sure. But anyway, it still feels a little delicate. Yep, so just moving all that stuff out, 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 and then down. Okay? All the way to your clavicles. So I would encourage you, if you have any need, lymphatic drainage is great in general. If you have a desire to increase detoxification in your entire body in a way that is far less labor intensive, there are two main things that I recommend. USANA is a supplement company that I live for and love for over 11 years. But their multivitamin supports phase 1 detoxification of the liver, which is another organ of elimination, probably one of the bigger ones. And then Hepacil, their liver support, is amazing, which supports phase 1 and phase 2 detoxification, which is huge. I started taking it for cystic acne, and it has rid me of such things. Anyway, so doing something daily is how detoxification works. If you want to give yourself a bump up, lymphatic drainage is awesome, all right? Especially if you have something acute. This is acute, right? I'm not going to have this wound forever. So anyway, it's something that can assist you should you wish to use it. So be in touch if you have more questions, if you have more needs, for any reason, all right? Thank you, and until next time.